Hi everybody, my name is Ken, and I wanted to take some time to record a couple videos to try to maybe get some good information out there to people that might be having a lot of questions about their health. A little bit about me, I'm 41 years old, I'm from Texas, and in February of 2008, after a year of uh, strange occurrences in my health, I was diagnosed by MRI and lumbar puncture as having multiple sclerosis. And I wasn't satisfied with the diagnosis at all because of my progression. My progression didn't really match the idea of MS, but my neurologist at the time seemed pretty convinced. I was immediately put on Copaxone, which is a MS therapy, which entails daily injections um, of a compound of amino acids that are supposed to help regulate your immune system and slow the progression of the illness. But as I said, I wasn't satisfied with the diagnosis, so I did a lot of research. And to make a long story short, I discovered that I also had neuroborreliosis, or Lyme disease of the central nervous system. And it was very difficult for me to come to this kind of conclusion because testing for Lyme disease is very flawed. And I can sit here and I can talk for hours about the difficulties in properly testing for Lyme and my theories on why it's so difficult to test for Lyme, but I'll probably save that for a different video. I really just kind of want to make this as an introduction and sort of get the ball rolling for the series of videos that I'm going to post. For me, my illness started with a hyperreflexiveness in my knees and joint pain, in my knees and my hips that kind of moved around all throughout my young adult life and into my adult life. And it's progressed into a point where I have a lot of ataxia, stiffness of the legs, and inability to move the legs properly, which results in difficulty walking, balance issues, gait problems, things of that nature. Also, as part of that, if I'm on my feet for any length of time, it turns into crushing fatigue, where someone has their hand on the dial for gravity, and it feels like I weigh 1,000 pounds trying to move, and wearing cement shoes and carrying 1,000 pounds on my back. It just becomes very difficult to walk like that. In the last 6 months, I've developed a lot of neuropathy in my feet, which takes the form of a burning sensation on my feet, or they always feel like they're asleep, and it's very annoying. It's not that I can't deal with it; it's very annoying. I also have chronic tinnitus in my ears, ringing in my ears. Um, and as I said, joint pain that kind of moves around. Sometimes it's my knees, sometimes it's my ankles, sometimes hips, sometimes my hands, my shoulders, neck, things of that nature. Anyway, I've been seen by 4 or 5 different doctors. Thought that there was something physically wrong in my back, and maybe a nerve was being pinched. But I've seen 2 different orthopedic people, and they've all confirmed that there's nothing wrong with my spine. There's no stenosis of the spinal cord or anything like that. I was currently under the charge of a Lyme literate physician in Bedford, Texas, who is overseeing my therapy and had me on mixed oral antibiotics for about 14 months, and my condition just continued to worsen. So through a forum, a news group that I belong to, I was put in touch with people who recommended me to a clinic in Reno. It's the SIMC clinic, or Sierra Integrative Medical Center in Reno. And they said that their way of treating is much different. Doesn't really rely on antibiotics, although they will use conventional medicines if they feel it's warranted. But a lot of their therapy revolves around IV natural homeopathic techniques. They don't treat symptoms. They treat your immune system. That's what they do. They're attempting to get your immune system back into a state of homeostasis and back into a position where it can properly allow the body to heal from a chronic inflammatory disease or illness, which of course Lyme disease is. This is my first week's update. I've had a week of treatment at this clinic. They have treated me like royalty, and the cost is very affordable for what they're doing and the kind of care and treatment that I'm getting. My first day involved about 1.5 pints to 2 pints of blood work. They are testing it every which way to Sunday. They also performed what was called dark field microscopy on my blood, where they took a couple drops of blood, they put it under a microscope, and they use a dark field projection to be able, and a certain kind of stain, to be able to see things that can't normally be seen through normal use of a microscope. And it was kind of a great thing to be sort of vindicated in my research. Because not only did they show my red blood cells' inability to carry oxygen, and there are also things about my blood that indicate that I have a high liver toxicity, and you get to see the Lyme. The Lyme disease is swimming around in my blood. The Lyme Borrelia is like, it's a corkscrew-shaped bacteria called a spirochete, and you can certainly see the spirochete swimming around in my blood. And the different forms that bacteria can morph into was very evident in my blood. So that sort of kicked off my treatment, which was followed up with 2 days of detox IVs. And they also, as part of that, give a glyoxal shot, which helps the body maintain its oxygen level. They also give a vitamin shot, a multivitamin shot, as part of the detoxing. And then Thursday, they did what was called an ozone therapy on my blood, where they drained about 1.5 pints to 2 pints of my blood and then injected it with several big fat syringes of ozone. And the idea behind this is it releases or allows the blood to better maintain its oxygen level. They pipe this back into you, and while they're piping it back into you, they're running it through a UV light, which kills pathogens in the blood as it's circulated back into you. Friday's IV was a vitamin C IV and a hydrogen peroxide IV. Hydrogen peroxide, once again, is designed to help kill pathogens in your tissue and your body and to raise your pH level. The more alkaline your pH is, the less likelihood these organisms can live in your body. So that's really the goal behind the clinic, is they want to raise your pH. They want to help your immune system strip away the defenses of these pathogens so that it can properly kill them. The overall results of this first week, you know, I mean, from a mental and emotional standpoint, I'm doing great. You know, from the stomach up, I'm feeling really good. It's just from the thighs down, I still feel a lot of weakness, and overall, after the detox and after the ozone therapy, I'm pretty wiped out. So it's difficult, but I'm very confident, and my doctor that's seeing me now is very confident that in the next 4 to 8 weeks, I should be walking normally again. He's seen patients that have my identical symptoms and my identical progression of illness, and he has totally helped them regain their lives. So I hope you guys watch this video. I hope you have questions. Feel free to make comments here on this post, and look forward to hearing from everybody and to answering questions, and I'll follow this up with another video a week from now. So anyway, everybody take care. Bye.